Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. Today I'm going to do a continuation of the topic from last week, toxins. We're going to present a little more material, some great studies on the effects of toxins and motivate those of you who have never had your body tested, perhaps to get tested for things like arsenic, lead, mercury, cadmium, and uranium, the top 5 heavy metals that we're concerned about, and chemical toxins like glyphosate, the most common pesticide that people are exposed to, people that work in agriculture or people who live near agriculture. If you're downwind from a field that might be a mile away, but if you sleep with your windows open and that stuff's in the air, you're going to be breathing it. And I've tested people many times who said, "No, I don't live anywhere near a farm." And then I look up on the map. Well, it's almost a mile away, but when we test you, you're still, have a high body burden of that. I had a woman in her 30s who was an attorney, was working indoors her whole life, in a courtroom, in an office, couldn't believe that she had exposure to glyphosate, but it was very, very high and explaining a lot of the symptoms that she had. And just by giving her some things to gently flush that out, she's been feeling a lot better for a long time now. So yeah, it's very difficult to tell if you're exposed to these things, and that's why it's so critically important to get tested to see if you have a body burden of various pesticides so that you know that you need to flush those things out. Do you or does someone you know have an unexplained rash that no one's ever been able to resolve? Having extra toxin, your skin is an organ like the kidneys and the colon. Your skin is an organ of elimination. That's why sweat smells sometimes. That's another way that your body flushes things out of the body. So when you're having an abnormal amount of that or been exposed to certain things, a rash can be caused by your body's attempts to get rid of that stuff. People that have autoimmune conditions like rheumatoid arthritis or Hashimoto's, the low thyroid condition that's caused by your immune system overproducing certain. Your body doesn't attack. A lot of times people say, "Oh, you have an autoimmune condition because your body's attacking itself." Nobody's immune system attacks your own body. It overproduces certain things that are normal for it to produce. What's happening is your immune system is finding foreign debris in places in your body where it doesn't belong. That's why so many autoimmune conditions start in the gut. Things are getting into your bloodstream, migrating to other tissues that don't belong there. Foreign debris, foreign protein fragments, and other things end up, and if it gets lodged in your thyroid, then your immune system rightly sees that as something that doesn't belong there, and it attacks it. And that is the etiology, the cause, and the mechanism of a lot of autoimmune conditions. So lupus, multiple sclerosis, any of these types of autoimmune conditions can be caused or dramatically exacerbated, made worse, and made much more difficult to treat and resolve if you have a high body burden of toxic chemicals, heavy metals, mold toxins, and these various other types of toxins. If you have a family history of cancer, then exposure to these toxins can doubly increase your risk of certain cancers. And any stress they impose stress on your immune system. The toxins make it more difficult for your immune system to fight off any cancer. And most doctors never test for these things. At best, they'll do blood tests. If you have a known exposure, something that you knew happened, you can go, "Oh, I think I might have gotten exposed to mercury. Let me go get that tested." And they'll do a blood test. And if doesn't show up in your blood test, they tell you you're fine. Well, that's not true. It's good that it's not showing up in your blood test, but it will only show up in a blood test if you've had a recent, relatively significant exposure. And most people have no idea when they're exposed to these things. They're exposed to minor, small amounts over years and even decades, and you have no idea, you have no symptoms to warn you of that, to alert you to that, until many years later, until it gets bad enough to stress a part of your body that it shows up in some kind of a symptom. Because your body stores these things in fat cells. It wants to get it out of your bloodstream so it's not circulating around, affecting your brain, affecting your heart, affecting your liver and kidneys. So it tries as best it can to eliminate an exposure to any kind of toxic chemical or heavy metal by flushing it out through the kidneys and the colon and the urine and in the stool. But what it can't flush out, it wants to get out of circulation as quickly as possible. So as a protective measure, it will shove it into fat cells just to get it out of circulation. But then unfortunately, these toxins remain in your fat cells forever. And the way you can test this is with a urine test that identifies what your body is, the small, tiny amounts that are coming out in the urine, and sometimes you can take certain agents to facilitate your bodies to excrete a little bit more of that just for the test. And then there are ways you can safely excrete these things and increase your immune system's ability to fight off most conditions, reduce your risk to certain cancers. These things are often also very commonly implicated whenever a condition of the brain is involved. So mood disorders, anxiety and depression, brain fog, unexplained fatigue or malaise, anything that makes an increased risk of dementia in older age, Parkinson's and various forms of dementia are also more likely to occur and more difficult to address if you have a high body burden of various types of toxins. As a reminder, you can listen to past episodes of this show anytime you like on my website. You can also subscribe to the podcast on Apple Podcasts, on Spotify, and on YouTube so that it comes to your whatever you're chosen, whichever one of those things you like the best. If you, for example, if you go to Apple Podcasts, it's the little purple app on your iPhone or your iPad, and then search for Safe, Effective Natural Solutions or my name, Dr. Todd Binkley, and you'll see the podcast come up there, and you can just click subscribe, and then each week that episode of the show will show up in that app. You just open the app, and there it is, and you can listen to it anytime you like, and there's also a transcript provided by all of those outlets on Spotify, on YouTube, and on Apple Podcasts. You can find a place there, click, and it'll show you the transcription if you want to read about some of the things you heard me talk about or didn't quite hear something and want to look it up. And as a complement to this show and the podcast, I'm also now doing a series of presentations in my office in downtown Ventura, live at Binkley Healing Center. Every month, the first Wednesday of the month at 6 p.m., we'll have a 20 to 30-minute presentation, some light refreshments, and then plenty of time afterwards for questions and answers. I always love hearing your questions. I'm really excited whenever people send me questions because it gives me more material to cover on this show. Please let me know what you would like to hear about on future episodes of this show. But it's also nice to meet you face to face and hear your questions in person. You're welcome to bring your friends and family, anybody that has a concern or a question. What about this? Can you help with this? What causes this? I've had this condition for so many years and no one has been able to help me. Anything like that. There's no bad questions. So yeah, please join us the first Wednesday of the month, 6 p.m. So the next presentation will be Wednesday, November 5th, first Wednesday of the month, 6 p.m. at Binkley Healing Center in downtown Ventura, 961 East Main Street. Space is limited, of course, so please RSVP if you're going to make it and how many people you might like to bring. RSVP 805-612-5531. So if you're able to come to the talk, it's first Wednesday of every month, 6 p.m. Next one, November 5th. Reserve your spot, 805-612-5531. The presentation will be on toxins, how to test for them, identify them, why you should do that, who should do that, how to safely eliminate them. And I will be doing a really great case study of a 32-year-old man that came into me with some really severe fatigue and dizziness. He'd been going to the emergency room and seeing all kinds of doctors that no one was able to help him for about 7 months. Really debilitating symptoms, and I finally identified that the thing that everyone else was missing after all the other tests that he had done by other doctors and that I did on him as well. He had a large exposure to chemical toxins, and when we started to get that stuff flushed out, he felt like a whole new person again. And it is, of course, Breast Cancer Awareness Month still this month, so any questions when you come to the live presentation, I'm happy to answer questions about toxins and any other topic that you'd like to talk about. I'm Dr. Todd Binkley. You're listening to Safe, Effective Natural Solutions to Almost Any Health Challenge. This week, I got a question, or last week, a few days ago, I got a question from one of the listeners about Piriformis syndrome. What is that? Well, the piriformis is a little muscle about 3.5-4 inches long in the upper glute area. It is a hip rotator, meaning it turns your foot out, like a ballerina turns their foot out, or soccer players often use that muscle. If you're not a ballerina or a soccer player, you probably don't use the piriformis and the other hip rotator muscles that much, but it's in the upper glute area. It attaches to the tailbone area, the sacrum specifically, at the base of your spine, and then goes out to the side and attaches to the femur, the hip bone. That spot, if you just put your fist against the side of your hip, that bone that you can feel, that's the top of the thigh bone, the femur. The piriformis goes from that to the base of your spine. So a lot of overlooked low back pain. And sometimes people have, so piriformis syndrome is if you have pain right in that, some doctor has identified that the cause of your pain in that area is because of a spasm, inflammation, irritation of this muscle. It's also a really commonly overlooked cause of low back pain and sciatica. So it pulls on, when it's tight, when this muscle is tight, it pulls on the base of your spine and irritates other muscles going up into your low back, and is a very common cause of low back pain. And it's also a very common cause of sciatica. The sciatic nerve is a bundle of nerves that exit the spine near the base of the spine, the low back and the sacral area, right above the tailbone. And these nerves come out from several levels of the spine and then merge together and form this big bundle of nerves that go all the way down the back of your leg, back of your calf, even all the way down to the bottom of your foot. And in fact, everything below your knee is innervated. All the muscles, all the nerve endings, the pain sensors, and all the nerves below your knee are branches of the sciatic nerve. And so it's very common if you have numbness, tingling, burning, or pain shooting down the back of your leg or anywhere, anywhere along that pathway. It could be just in your foot or your ankle, your big toe. That's often because of pressure on that nerve. And the nerve endings can commonly get pressure on them from a herniated disc. It's a common symptom of a herniated disc to have those pain, burning, numbness, tingling going down the back of your leg. But it can also very often, probably more often in my experience, it is caused by pressure on the sciatic nerve bundle from the piriformis muscle. This hip rotator muscle in the upper gluteal area goes from the tailbone area to the femur, the thigh bone. And when you have spasm in that muscle, it often doesn't hurt right in that muscle itself. It can, but it's more common to have pain in the low back or going down the back of the leg when you have a spasm in this muscle. It's very easy for me to identify. So if you suspect that you have that, I'd love an opportunity to identify that, whether or not that's a cause of your issues. I see it probably in 80% of the patients that come to me for non-force chiropractic. I check it on everyone, and it is so very, very common to have tightness, restriction, or even a full-blown spasm in this muscle. It's often not a full-blown spasm. It's most commonly just really, really short and tight because it's been too tight for years and years, even decades. You can tell by how tight it is. Some people come in and they have no range of motion in that muscle at all. What does that look like? You're lying on your back with your knee pointing straight up towards the ceiling, your foot on the table. So knee bent, foot on the table, lying on your back, and knee pointing straight up towards the ceiling. And then I push that knee towards the opposite side of the body. This muscle, that's the way you test the piriformis muscle. It goes from the base of the tailbone area over to the thigh bone. So when you push on the thigh bone, you're testing the length and relative flexibility, range of motion in that muscle. And it's really restricted in many, many, many people. Most people who have low back pain have restrictions in that muscle. And so to fix it, you stretch it on the table. I help you loosen it up on the table over a series of visits. It's more difficult than some muscles to get loosened up completely, but it always feels better immediately when you just start to lengthen that muscle, release some of the tension from that muscle when it's really tight. It can also very, very quickly eliminate sciatica just by getting that muscle loosened up. One of the worst scenarios with tight piriformis muscles is when it's really, really tight on one side and not that bad on the other side. The imbalance of it's better to have both sides equally tight than to have one side really, really tight and the other side not so much, because that imbalance makes the symptoms even worse, and it's often more difficult to release that tighter side when one side is a lot tighter than the other, and it's not uncommon for that to happen. I've got a couple of patients right now that just have no motion at all. When I lie them on their back, knee pointing straight up, try to push it to the opposite side of the body, no motion at all. It's just totally stuck. And so working on the table, we can get that to loosen up, and it very quickly starts to feel better. One of the most severe cases I had a few years back, a 16-year-old cheerleader who had been dropped a few times, fall on her butt, obviously, and that's how we figured out later that caused this tremendous pain that she had in her right hip. And she had been to several doctors. Nobody could help her. She even went to a surgeon who was thinking about recommending some sort of surgical procedure. She wasn't even clear on what he was recommending doing, just saying he's possibly could be a candidate for some type of surgery. I can't even imagine what that would be, but surgeons like to do surgery. But fortunately, she did not need that. I very quickly got her pain to where she could get back to her normal activities after just about 2 or 3 weeks. She was feeling at least 50, 70% better, something like that. I know that she could go back to doing most of the things that she wanted to do. And, then I think I probably had her coming in once a week for another month or so after that. And after, maybe twice a month for a month or so. After about 3 or 4 months, she was completely back to normal, as good as new. So 16-year-olds respond a lot faster than 60 or 70-year-olds. But no matter how bad it is and how old you are and how many years or decades that muscle has been tight, when we just start to loosen it up, you immediately start feeling relief. If you just tuned in, I'm Dr. Todd Binkley, and the theme of this week's presentation is toxins. And it's important to note, especially the following. The brain is the most sensitive organ in the body to any kind of nutrient deficiency. The brain is the most sensitive organ in the body to any exposure to toxins. And those two things often go together. If you're exposed to a lot of toxins and are not getting adequate nutrients, you're going to have more severe symptoms from that if your body lacks the things it needs to flush out. But you never know how much you have unless you do certain specific types of tests, usually urine tests or heavy metal hair tests, identify what you have, your body burden of those things. And so if you have an increased body burden, it increases your risk of chronic degenerative conditions of the brain like Alzheimer's, other forms of dementia, and Parkinson's. And there's some really good data that's come out recently in the literature. This is a study published in the journal Neurology where they analyzed the records of more than 1 million Medicare beneficiaries and showed that exposure to ambient trichloroethylene, a common chemical used in degreasing and in dry cleaning, ambient exposure. What does that mean? That it wasn't people that were exposed, it wasn't people working degreasing engines and other machine parts in certain industries or in the military, very common exposure. People that worked in dry cleaners or in the places that make those chemicals obviously are going to have significant exposure to those chemicals. This wasn't any of that. There was no direct exposure to all. This was just breathing in, just living near these places, living a certain distance from these places and breathing it in through the air had a 10% increased risk of Parkinson's disease compared to people that lived further away from them. So this was reported by Brittany Krzyzanowski, PhD of the Barrow Neurological Institute in Phoenix, and certain co-authors. Exposure to outdoor trichloroethylene was associated with new diagnosis of Parkinson's disease 14 years later in a dose-dependent manner, meaning the people that lived the closest to the sources of that chemical had higher risk. Well, other studies, I've reported recently a study on this show about the increasing proximity to a golf course. Just living near a golf course because of the pesticides that they use on the grass can dramatically increase your risk of Parkinson's disease. And there's been evidence linking air pollution to Parkinson's disease. Certain other studies, certain other pesticides have long been associated with it. And air pollution, pollutants from wildfires and other particulate matter in the air that we're breathing in more and more of every year has been tied to an increased risk of Parkinson's disease. But this is the first study that's shown that it's a link just from breathing the air near sources of these chemicals, and it's an environmental exposure that's widespread, but a lot of neurologists are not familiar with. They cited in this article cites that environmental exposure to this has been detailed in the books A Civil Action, which was also made into a movie, and the Pulitzer Prize-winning Tom's River. So trichloroethylene is a volatile chemical that's used to dry clean clothes, like perchloroethylene, very similar. Trichloroethylene and perchloroethylene are very similar chemicals that are used to dry clean clothes, degrease metal, decaffeinate coffee. Yikes. Decaffeinated coffee. Some of the ways they decaffeinate coffee are really, really toxic. I don't recommend decaffeinated coffee. By the way, since we're on that subject, decaffeinated coffee is not caffeine-free. So if you want less caffeine but you really like coffee, then just drink less regular coffee. That's my recommendation. But these things are also even used to anesthetize pregnant women. Wow. There's a horrifying thought. I wonder where that was happening. I'll have to look that up. Toxic chemical causes cancer has been well known to cause cancer for 50 years or more, but this link to Parkinson's disease is relatively recent. So the EPA, the Environmental Protection Agency, banned most uses of trichloroethylene and perchloroethylene. As of June 2025, most of the ban is likely to remain in place and will lead to a phase-out of uses of the chemical over the next decade. However, the ban does little to address the thousands of sites contaminated with the persistent chemicals, these chemicals and others that are around the U.S. and around the world. So if you or someone you love lives near one of these places, it's a very good idea to get a urine test to measure your body burden of these chemicals. They can increase your risk of any brain condition. So in addition to Parkinson's and dementia, they can also increase risk of anxiety and depression or make those conditions worse. They very often contribute to brain fog and fatigue. And some of you may be becoming fatigued hearing me talk so much about toxins over and over again because it can be kind of confusing. But it is so important to get these things checked if you have any of those symptoms. So back to Parkinson's, there's another study that came out relatively recently. Exposure to the industrial solvent trichloroethylene and other volatile organic compounds in drinking water raised the risk of Parkinson's disease decades later in an analysis of 158,000 military veterans. So this was personnel, they compared military personnel who lived on the base at Camp Lejeune in North Carolina from 1975 to 1985. They compared them with military personnel that lived at Camp Pendleton, a large California base, which most of us are familiar with around here. So the people at Camp Lejeune in North Carolina had a 70% higher risk of Parkinson's disease compared to the people that lived at Camp Pendleton. This is reported by Samuel Goldman, MD and Masters of Public Health, the University of San Francisco, and San Francisco Veterans Affairs Medical Center, and their co-authors. So it was published in Journal of American Medical Association Neurology, and the exposure occurred when Marines were an average of age 20, and the Parkinson's diagnoses emerged at Camp Lejeune on average 34 years later. So when you hear me talk about, this is a perfect example of how most people are totally unaware of their exposure to these things. No, they don't have any symptoms until years later. In this case, Parkinson's showed up 34 years later. So average age of 20, these men and other men and women serving, and it most often shows up 34 years later in your 50s. So trichloroethylene has been used since the 1920s to decrease metal, decaffeinate coffee. Talked a little about this already. It's been linked with cancer, miscarriages, neural tube defects where people have a cleft palate or parts of in the middle of the body, parts of the spina bifida, where the bones don't close in the middle. Congenital heart disease, which one of the most common one of those is where there's a hole between one side of the heart and the other, or just underdeveloped heart tissue. Autoimmune disorders, which we talked about, and Parkinson's disease. So from 1975 to 85, the median monthly level of trichloroethylene in the Camp Lejeune drinking water was 70 times higher than the permissible level. Wow. So their drinking water, it's unavoidable. Their drinking water has 70 times the permissible level of trichloroethylene. And the wells providing this water were taken offline in the mid-'80s after the contamination from underground storage tanks, industrial spills, and waste disposal sites for the trichloroethylene, and an off-base dry cleaning business for the perchloroethylene after these were discovered. So the co-authors evaluated the health reports of 172,000 Marines and Navy personnel who lived at Camp Lejeune from 1975 to 85 and compared them with 168,000 Camp Pendleton personnel. And interesting to note that the study was just the military personnel that lived on base. It excluded their spouses and dependents and the large civil populations who worked at the base. So this, of course, means that these studies are dramatically underestimating the effect on the total population. We're going to be doing more studies on this, and of course, I will report them when they come out. We are almost out of time again to hear a fascinating presentation on toxins and some great case studies of people who I have helped by getting those toxins flushed out. Join me November 5th, Wednesday at 6 p.m. at my office for my presentation, Toxins, live at Binkley Healing Center. We'll have plenty of time afterwards to answer any and all of your questions, and I'd love to meet you and answer them face-to-face. Until then, have a blessed weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 2 p.m. for safe, effective natural solutions here on 98.3 FM, The Word.